Namaste. Myself Dr. Shilpa K, Assistant Professor from Department of Kayachikitsa, Yenepoya Ayurveda Medical College and Hospital, before you all to present on the topic Samanya Vata Vyadhi Chikitsa. So the specific learning objectives are to explain the general treatment principle of Kevala Vata or Nirupastamba Vata Vyadhi, to analyze the importance of Snehana and Swedana in Vatavyadhi Chikitsa, to explain the Shodhana Chikitsa in Vatavyadhi, to choose right treatment, especially in case of Durbala patients, to explain about the post-Shodhana therapies, to recollect few Ahara Viharas indicated in Vatavyadhi. So these are the contents of my presentation. So moving on to the topic proper. So what exactly is Vatavyadhi? Acharya Charaka tells that Vatena Janito Vyadihi Vatavyadhihi. So in Madhava Nidana further explanation is found. Vikrita Vata Janito Asadharana Vyadihi Vatavyadhihi. So the disease which is occurring because of the vitiated Vata dosha is termed as Vatavyadhi. If we look into the general clinical scenarios, we observe that most of the patients who come for Ayurveda IPD basis treatment would be either concerned to musculoskeletal system or it would be neurological system. So all of this come under the broad umbrella of Vatavyadhi. So it is very important to understand Samanya Vatavyadhi Chikitsa as it encompasses a broad spectrum of diseases which are quite common in clinical practice. So let us move on to understand the general treatment principles of Samanya Vatavyadhi. So moving on to Kevala Vatavyadhi or Nirupastamba Vatavyadhi Chikitsa. So what exactly is Kevala Vata or Nirupastamba Vata? So Kevalam iti asamsrishtam. So Acharya Charaka very clearly says what exactly is Kevala Vata. So it is asamsrishta Vata, means it is not associated with other doshas like Pitta or Kapha. So Nirupastamba, what exactly is Nirupastamba? Nirupastamba iti anavritam, that is, there is no avarana there. There is only one dosha, that is Vata, it is involved, and there is no avarana pathology. So if this is a condition in any of the diseases, then what treatment protocol one needs to adopt is very clearly explained by Acharya Charaka in Charaka Chikitsa 28th chapter, and here is a quotation. So Kevalam Nirupastambam Adau Snehairupacharet. So what is the first line of treatment? It is Snehana. It is very important to adopt Snehana line of management in Kevala Vatavyadhi. So how this Snehana procedure can be done? What are the things we need to do to adopt this kind of treatment? So Vayuhu Sarpi Vasa Taila Majja Panai Naram Tataha. So we know four types of snehas, that is Sarpi, Taila, Vasa as well as Majja. So these four sneha dravyas can be utilized to attain the snehana. Sneha klantam samashwasya payobihi snehayet punaha. So once snehana is attained, after consuming these types of sneha dravyas, then ashwasana, the patient must be consoled and he must be asked to take rest for a while, and then payobihi snehayet punaha. Then further paya, that is milk, can be given to induce further snehana. Further, this has to be continued. The Snehana procedure has to be continued by giving other things like Yusha, that is various soups which are prepared out of the pulses, or Gramya Ambuja Anupamamsa Rasa, that is various meat soups can be given, which is added with unctuous substances. Sneha Sanyuta means which is added with either Grita or either with Taila. Further, other food items like Payasa or Krishara. So again, the ideology is to do Vata Shamana. So Krishara Samla Lavanair. So what kind of Krishara or the Khichdi preparation should be given, which is added with much of sour items or which is predominant with the salt? Because we know that Amla as well as Lavana has the Vatahara property. So that has to be given. And the procedure like Anuvasana Basti, which is nothing but the Sneha Basti, has to be adopted. Other treatment modalities like Navanai, Starpanai, Channai, Susnigdam, Svedayetataha. So the Navana, that is Nasya Karma, can be done. Various nourishing therapies can be done, as well as further the Snehana as well as Swedana Karma should be continued. Next, what kind of swedana procedures should be adopted is very much specified in the next line. Swabhyaktam sneha sanyuktair nadi prastara sankaraihi. So, the nadi prastara as well as the sankara sweda is specifically mentioned by Acharya here. So, how it has to be given? After proper abhyanga. Swabhyaktam means after proper abhyanga, swedana treatment has to be done. As well as we can also adopt other kind of swedana therapies as and when it is required and as per the condition of the patient. Tata anyer vividaihi swedair yatha yogam upacharet. So, as in when we found necessity to use some other types of swedana, and as per the condition of the patient, we can select the suitable kind of swedana therapy. So, the very important procedures, that is Snehana as well as swedana in Vatavyadhi. And Acharya explains why it is important to adopt Snehana karma. So, Ruksha Shuddha Anilartanam Atah Snehan Prachakshmahe. So, we know that in Vata doshas, when it is vitiated, there is increase in the rukshata in the body. So, in such condition, if Snehana is done, then it will help in reducing that ruksha guna, and it will help in doing the roga shamana, vividhan vivida vyadhi prashamaya amrutopamam. So, it is just like a nectar, it is like a amrita which helps in healing the disease. So, these Grita Prayoga, Majja, Vasa, Taila, as I mentioned, are the 4 important Sneha Dravyas which are used for the Snehana karmas. So, speaking about the Swedana therapies, like we have various techniques or the treatment modalities, like Upanaha, it might be like application of lepa and bandaging, this can be done, as well as we have avagaha, wherein a tub is filled with kashayas or tailas and the person is asked to sit in it, this kind of swedanas, or the nadi swedam, where a tube is used, the steam is let into the affected area, as well as dhara. Okay, various procedures, these kind of swedana techniques can be adopted. So, what are the benefits of this Snehana and Swedana? It is very beautifully explained by Acharya Charaka in these 3 quotations. So, he says, Snehaktam svinnamangam tu vaktam stabdhamatapiva shanair namayitum shakyam yatheshtam shushkadaruvat. So, once the Snehana Swedana is done, the body becomes so flexible. Even a rigid body can be bent as and how it is required just by doing this Snehana as well as Swedana. So, further specifically he tells how Swedana helps in treating Vatavyadhi. Harsha Toda Rugayama Shota Stamba Grahadayaha. So, these are the symptoms which are explained, like Harsha, that is different kinds of horripilations, or Toda, different kinds of pain, then Ayama, that is muscle contractions, etc., or swelling, Shotha, Stamba, stiffness and rigidity in the body. All these things can be relieved by Swedana. Svinnastyashu prashamyanti. It will help in immediately relieving all these kind of symptoms which are present in the Vatavyadhi. Further, how does Snehana help? Snehascha dhatun samshushkan pushnatyashu prayojitaha. So, we know that there is excess of ruksha guna, there is dhatu shushkata in case of Vatavyadhi. So, this Snehana will help in nourishing the body, it will help in nourishing the shushka dhatus, and hence instantly it will give bala, balam, agni balam, pushtim, pranams chapi vartayet. So, immediately it will help in providing strength to the body, it will even kindle the digestive fire. Agni bala here refers to the digestive fire, it will help in kindling it, as well as it will further enhance the quality of life of an individual. So, this was all about Snehana as well as Swedana procedure, which is the first important line of treatment in case of Vatavyadhi. So, further Acharya says this kind of Swedana as well as Snehana must be done repeatedly. It's not that once it is done and it is left as such. No. Looking into the condition as and when the symptoms are relieved, looking into that repeatedly, this treatment procedure has to be adopted. So, what is the benefit of this? Asakritam punaha snehai swedais chapyupapadayet. Asakritam here refers to repeatedly one has to adopt these treatment modalities. Tata sneham mridau koshte na tishtatya nilamayaha. So, once that the kosha becomes mrudu, the rukshata goes off by doing this repeated Snehana as well as Swedana, then there will be no any place for the Vatavyadhi. Na tishtati anilamayaha means the disease will be relieved and there is no further chance of being afflicted with the Vatavyadhi. So, this was all about the two important treatment, that is Snehana as well as Swedanam. Further, Acharya speaks about the Shodhana Chikitsa. Charaka says, when do we have to adopt or when do we have to go for the Shodhana treatment? He says, Yadyanena sadoshatvat karmana na prashamyati. That is, when, after doing all these treatment, if the dosha is not being subsided, if the disease is not being relieved, then we can adopt the Shodhana Chikitsa. So, what kind of Shodhana we have to go for? Further he explains, Mrudubihi Sneha Sanyuktair Aushadaistam Vishodayet. So, we have to go for the Mrudu Shodhana. We cannot go for Tikshna Shodhana in case of Vata Vyadhi, because we know once there is Tikshna Shodhana, obviously it will further increase the Vata dosha and there is all chances of increase in the symptoms. So, very carefully we need to adopt the Shodhana Chikitsa in Vata Vyadhi, and that should be very Mrudu. And it should be Sneha Sanyukta, that is, the Shodhana medicines should be mixed with the Ankshuk substances, or whatever the Sneha Dravya itself can be given for the Virechana. So, Sneha Sanyukta. So, what kind of drugs we can give to induce this Shodhana? So, Ghritam Tilvaka Siddham Vat Satala Siddham Evacha. So, the purgatives like Tilvaka Grita or Satala Grita can be given, and very important, Payaseranda Tailam va Pibe Doshaharam Shivam. So, very important medicine what we give for purgation in case of Vata Vyadhi is Eranda Taila. So, Eranda Taila mixed with milk can be given for Virechana, which will be again Sneha Sayukta, as well as it is Mrudu, very mild form of purgation, hence it will not increase the Vata dosha. So, but if the person is Durbala, what can be done if we cannot go for Virechana? So, Durbalo yo avirechaha syatam niruhair upacharet. So, if the person is very weak and we cannot go for Shodhana like Virechana, then we can adopt the next treatment modality, that is Niruha. Niruha Basti can be given. But here we may get a doubt, like in case of indication as well as contraindications for Astapana Basti, we find a word Durbala. Durbala is contraindicated for Niruha Basti. But here Acharya in the Tika Chakrapani very clearly says that is Athyartha Durbala. Athyartha Durbala is Anastapya. We cannot go for Astapana or the Kashaya Basti. But here Acharya is not speaking about that severity or such a weak person, but it is just moderately weak person. We can go for the Niruha. Further, the next line tells Pachanair Deepaniyairva Bhojanais Tadyuttair Naram. So, further, if the person is Atyartha Durbala, if the person is very weak and we cannot go for Astapana Basti, then in such condition, we can go for the simple line of treatment like Pachana, Deepana or any of the Shamana Aushadas. So, giving different diet preparations which will help in Vata Shamana, or different medicines which will increase the Agni, which will relieve the symptoms, such Shamana Aushadas can be given. So, it is very important to analyze the bala of the patient and then give the treatment to get a success in the treatment. So, this is about treatment modalities in Durbala individuals. Further, once Shodhana is done, then what has to be done further? So, Charaka clearly says, Samshuddhasyo thite chagno sneha swedau punarhito. So, once Shodhana is done, further the person's considering the Agni of the person, okay. So, once the Agni is kindled, then further Snehana Swedana must be done. Next, what kind of aharas or the food items must be given to the patient? So, Swadu Amla Lavana Snigdhair Aharaihi Satatam Punaha. So, the diet or the food what is given, it should be very predominant with the sweet, that is Swadu, Amla, sour taste, as well as added with Lavana, and it should be Snigdha, it should be unctuous, added with Grita or Taila as per the indication. So, this once it is Swadu Amla Lavana Snigdha, obviously it is Vatahara. So, that kind of food item should be given repeatedly. Then we can also go for other procedures like Navana, that is Nasya, Dhumapana can be done. Iti Samanyatah Proktam Vatavyadhi Chikitsam. So, this is the general line of treatment in case of Vatavyadhi. Further, if there is any other dosha associated with Vata, either kapha or pitta, or if there is any other pathologies like avarana pathology, then what has to be done? So Charaka clearly says, kriya sadharani sarva samsrishte chapi shasyate vate pittadibhi srota swavrateshu visheshataha. So he further explains very specific treatment lines. So if there is samsrishta condition, what has to be done, and if there is avarana pathology, what has to be done. So once avarana and samsrishta dosha is treated, then we can obviously adopt this Samanya Vata Vyadhi Chikitsa. So I will not be discussing about samsrishta and avarana condition here in this session. So further, there is one important line which is told, pratyekam sthana doshyadi kriya vaishesham acharet. So we understand the Vata Vyadhi Chikitsa and likewise we practice, but still based on the sthana, based on the location of the disease, based on the dusha which is involved, using our yukti, we can adopt Vishesha Chikitsa. So the selection of the treatment, the selection of the medicines, everything will depend upon the yukti of the bishop. So next important aspect is the ahara vihara, the diet regimens and various other regimens to be followed in case of Vata Vyadhi. So this is the quotation of Charaka. He says, Sarpistaila vasamajja sekabhyanjana bastayaha. So we all know Vatahara diet or food items has to be consumed. Again, the 4 types of Sneha dravyas are conducive in case of Vata Vyadhi, along with procedures like Seka, Abhyanga as well as Basti, which I mentioned previously, can be adopted. Snigdaha swedaha nivatam cha sthanam pravaranani cha. So Snehana swedana is the best thing which can be done in case of Vata Vyadhi. Nivatam cha stharam. So person should reside in a place devoid of breeze or wind, because it may further increase the Vata dosha. So this is one important thing which is mentioned, which we can advise to the patients as well. Rasaha payamsi bhojyani swadvamla lavanani cha. So intake of various meat soups or milk as well as the food preparations which are again predominant of Vatahara rasas, that is Swadu, Amla as well as Lavana rasa. So Brahmanam yacha tatsarvam prashastam vataroginam. So whatever the food items are having the Brahmana property or the nourishing property, so such things are said to be best for all the individuals suffering from the Vata Vyadhi. So this is regarding the ahara as well as vihara. Further, Shushruta tells about some other preparations which can be used. Panchamuli Shritam Kshiram. So the Kshira which is boiled with Brihat Panchamula. Phalamlo Rasa. So any of the fruits which are Amla, such things, Rasa Evacha as well as Mamsa Rasas. So Susnigdo Dhanya Yusho. So the soups which are prepared out of various dhanyas or pulses which is added with unctuous substances like Grita or Taila, or which is seasoned with the Grita or Taila, are conducive for the Vata Rogis. So this is about the diet regimens which can be followed in case of patients suffering from Vata Vyadhi. So here I conclude. So before concluding, let me sum up the things whatever we have discussed. So we know that in Kevala Vata Vyadhi Chikitsa, the first important thing which has to be adopted is Snehana. So Snehana and Swedana are the highly beneficial procedures in case of Vata Vyadhi. Further, Shodhana can be done, but what kind of Shodhana has to be adopted? It is Mrudu, Sneha, Virechana must be adopted. If the patient is not fit for Virechana, then we can go for Niruha Basti. And if the patient is Atyanta Durbala, we cannot go for even Basti, then in such conditions, Deepana, Pachana and Shamana line of management can be followed. So further, if there is Samsrishta dosha condition or Avarana dosha condition, we can go for Vishesha Chikitsa. Specific treatment lines are further explained by Charaka. So speaking about the Ahara Viharas, so whatever the things are Vatahara can be given to the patients, inclusive of all the 4 Snigdha dravyas, that is Sarpis, Taila, Vasa, Majja, as well as whatever is considered to be Brahmana, nourishing to the body, is said to be conducive for a Vata Rogi. So here I conclude. These are the references. Thank you. Thank you one and all.